like we just did, the SC and the AC joint, again, I don't do as often. If I'm doing some glenohumeral Mobz, I'm probably gonna be doing some scapular Mobz, all right? We talked about earlier in the last semester, you know, again, if this guy's moving, right? 2 to 1 type of ratio. So I need the scapula to be moving. If I've been in a sling for a long time, you know, it's not just glenohumeral tightness, it's also probably scapular tightness. Now, it's interesting here, you know, it's really not capsular tightness though, right? This is not a synovial joint. This is a synovial joint. So when we talk about this, we really talk about what's called joint mobilizations. Really, this is not really joint mobilization. It's more a scapular mobilization. We're really mobilizing, not necessarily capsule, we're mobilizing the muscles that haven't worked. So just don't get yourself caught up on a technicality there. It's not a joint mobilization, it's more of a scapular mobilization. Again, we kind of listed the scapulothoracic joint as a joint, but it's really not a joint. Remember, it's a functional articulation, meaning it doesn't have a capsule. Are we clear on that? So this is just movements that, again, I think you're going to find to be, but probably more important than the SC and the AC joint. Again, we just got, let me make sure I termed these right. We have 6 motions. We're going to do elevation, which is up, depression, protraction, retraction, and upward and downward rotation. We've done this, I think, once before. Again, if you think about what you're doing, your bottom or inferior hand is usually grabbing the angle of the scapula, inferior angle of scapula. I usually bring them into this position just so their arm kind of relaxes, and then I kind of grab a hold there, and I'm using this hand, all right? So if I'm doing depression or elevation, it's just like that, right? If I'm doing protraction and retraction, I'm kind of use my fingers and do kind of protraction and retraction. And then if I'm doing upward and downward rotation, I'm using more my bottom hand here to do upward or downward, okay? I'm using this hand as well to kind of make that happen, but just upward and downward, okay? She's got a good one to see because you can probably see it well. Go the other direction, roll on the other side so these folks can see it. So key is, again, make sure they're relaxed, so when they get their arm over there, they're kind of just letting it relax. This hand, again, grabbing the inferior angle of the scapula. In this case, then I'm just doing, again, elevation and depression, right? Inside of my, so protraction or retraction, protraction, retraction, and then upward, and again, it's the inferior angle of the scapula, and downward rotation, upward and downward rotation, right? Like if I felt hers, you can go back to the table. Like I would be like, okay, that's not her problem. So she's nice and mobile. So if for some reason she wasn't doing this, that's not the reason she's doing that. So if I felt something moving like she was feeling, I would be like, she's good to go. That is not what I need to spend my time on. She might have a capsular problem, but she does not have a scapulothoracic problem, okay? All right, let's do that, and then like I said,